Hello everyone, I hope you all doing well. In the previous video, we discussed about pharmacokinetic and its first step, that was absorption, and all its factor affect the absorption. And today, I will talk about the second step, that is distribution. And as we know that after absorption, the drug does not remain in the plasma, and it distributes itself throughout the body, and into body as well as in the different tissues such as adipose tissue and fatty, like muscles and brain. And when the drug is distributed into different tissues, it produces its therapeutic effect. And the most important factor for the drug distribution is the blood flow. The blood flow of the different tissues may be determined by the drug itself. We have an example of hydroxytryptamine is a vascular vasoconstrictor agent in all the tissues except skeletal muscle. Thus, it reduces the blood flow to all the tissues except skeletal muscle. Thus, distribution of the drug is greater to skeletal muscle. Similarly, adrenaline causes vasoconstriction in kidney but vasodilation in the bronchial smooth muscles. Our body consists of number of compartments to which the drug is distributed. These are as enteric, plasma, cerebrospinal fluid, intracellular spaces, urine, glandular secretion, bile, and erythrocytes. These are the different compartments where the drug distribute. Now we talk about the factors that affect the distribution of the drug, which is like we have very first factor, that is dose. As much as the dose, as larger the dose, the higher the concentration of the drug is achieved. Again listen, larger the dose, the higher the concentration of the drug is achieved. Next we have route of administration. Intravenous injection produces a rapid rise in the blood concentration, whereas oral administration gives slow rise and slow peak concentration, right? Next, we have lipid solubility. Those drugs which have high lipid solubility are rapid absorbed. That's we already discussed in absorption, and here we also reconnect it with distribution. As much as the drug is absorbed, that is rapidly distribute to different tissues as well as the CNS, but the drugs which are ionized at the pH of the blood are slowly distribute to different tissues and have poor penetration to CNS. For example, tetracycline and penicillin. The drugs like chloramphenicol, sulfadiazine are lipid soluble and are easily distributed to CNS. Third, I have another factor, that is pathological condition. It increases the permeability of blood-brain barrier. For example, meningitis, which is inflammation of the meninges. It increases the permeability of blood-brain barrier to CNS. So cephalosporins, which is antibiotic, are used to treat the meningitis because these are easily passed through the blood-brain barrier, right? Next we have factors, that is binding and the storage of the drugs which are bounded to the plasma protein, for example albumin, globulin, are slowly released and are slowly distributed to different tissues to produce their effect, right? The drugs may be stored in other tissues, such as we have an example of thiopentone, that is barbiturate, and grasofulvin. These are the drugs that stored in the adipose tissue. Likewise, we have an example of tetracycline and heavy metals. These are stored in bone, in teeth, and chlorpromazine. These are stored in brain. Tetracycline and chloroquine. These are stored in liver. We have so many example of these drugs that bind and store in the different tissues. And next we have local blood flow. Greater the blood flow of different tissues, greater will be the distribution because of greater absorption of the drug, right? as we already quote the example of deltoid muscle and buttock muscles, these are greater, so the drug absorption rapid, and so the distribution of the drug is also rapid in these muscles, right? Next we have complex formation. Most of the drugs forms complex with the ions present in the blood and decrease the distribution of the drug because the drugs are slowly released. For example, tetracycline form complex with the calcium ions present in the blood, thus the distribution of the drug is decreased, right? Next, we have specialized barrier that affect the distribution of the drug. First, we take like blood-brain barrier. The in this the transfer of the drug through blood-brain barrier is proportional to the lipid solubility of the drug, as we studied before, like as much as the blood is lipid soluble, the drug is more absorbed, right? Same thing is there, because the blood brain barrier are the lipoidal membrane, so lipid soluble drugs are easily passed through the blood brain barrier to enter into the CNS to produce their effect. Narcotic agents and barbiturates, we can take its examples, and we take name of some like diazepam, and these are lipid soluble drugs and are easily passed through blood brain barrier, right? Next we have an example of placental barrier. The transfer of drug through placental barrier takes place through the passive diffusion. Passive diffusion we learn in the last video, that need driving force, and that is provided by the concentration gradient, and drugs are easily passed through the placental barrier to enter into the fetus to produce their effect. The transfer of drug also takes place by simple diffusion and by the action of transport process, and is passed through the placental barrier to enter into the fetus. Though the passage of the drug through the placental barrier is safe for the mother, but may have pronounced adverse effect on the fetus. Next barrier we have, that is memory barrier. Drugs always pass into the memory secretions in unionized form, that is lipid soluble. The drugs are easily passed through the memory barrier because memory barrier act as a lipoidal membrane and enters into the memory secretions. The drugs which appear in the milk in sufficient amounts may affect the baby, such as antidiabetic, diazepam, lithium, and phenothiazines groups. These are the groups which may affect the baby, or maybe may affect the fetus. The distribution of the drug, age may also affect the distribution of the drug in babies and old age people. There is immaturity of the blood brain barrier, that is barriers are not fully developed, so the distribution of the drug is negligible. Here I conclude about the distribution of the drug. We discussed different factors, that is dose, routes of administration, lipid solubility, pathological condition, binding and storage, local blood flow, complex formation, and some specialized barrier, blood brain barriers, placental and memory barrier, right? Next we discuss about the third step, that is metabolism, and I hope you like it, and don't forget to like, subscribe my channel.